Okay, I just got a call to go to the ER. A patient needs to be manually ventilated, so I'm going to go ahead and grab my supplies. In the room will already be an Abmu bag there, but I went ahead and grabbed some different size oral airways just to make sure I have what I need when I go into the patient's room. I also looked up her chart to see if there was any facial trauma or neck injury. So I will, if there was, I would be careful in the chin or head tilt. I wouldn't go ahead and tilt her head all the way. I would maybe just use a two-finger approach, not to cause further injury to her neck. So upon entering, the patient was non-responsive. The nurses were working on her. I went ahead and washed my hands, put on gloves, grabbed my airways, and went ahead and measured to see from the tip of the mouth, or edge of the mouth to the tip of the ear. This looks like the best fit. This would have been way too small for her, and it wouldn't have provided a clear airway. So I go ahead and make sure that Mrs. Smith can't hear or is non-responsive. I'm going to go ahead and insert this. Her tongue's in the way, so I'm going to go ahead and insert it upside down and then halfway twist 180 degrees. So insert here halfway and then twist 180 degrees, keeping that tongue out of the way. Now that airway is secure. I have it resting on her mouth here. She can bite on it. It's a hard plastic oral pharyngeal airway. Now I have my Abmu bag. I'm going to go ahead and put the oxygen flow on, and I'm going to grab her chin here, creating a tight seal and chin tilt up. Best position is at the head of the bed, and I'm going to go ahead and start manually ventilating the patient. What I'm looking for here is a tight seal and chest rises when I administer breaths. I want to make sure that I allow the Abmu bag to completely refill, and I want to administer breaths 12 to 20 breaths per minute. So I'll go ahead and show you. That was about 16 breaths per minute there. Okay, I'll continue doing this until we wait further instruction if we're going to go ahead and intubate the patient, or if the patient starts breathing on her own. If she has some spontaneous breathing, I'm going to try to correlate the breaths that I'm administering with her breaths.